Wait a second. This isn't your grandma's cancer show.
Not your grandma's cancer show.
I'm Tatum, and today we are talking about chronic cancer. And one of our guests today, Lucy, described it as a cancer that doesn't fit into cancer boxes. We're going to ask her more about that a little bit later. And one of the reasons that it doesn't fit so neatly into those cancer boxes might be because there's a real array of experiences, from needing treatment as soon as you're diagnosed to waiting for years and years and years, watching and waiting till the levels rise and you're sick enough to be treated, to times when the chronic cancer is undetectable, but you still know there is treatment up ahead. So I'm really delighted to have with me David, Lucy and Kerrie, to share their experiences of what it's been like having a chronic cancer and some of the things that have helped them navigate all the uncertainty that goes with it. So, hi, David. Thanks so much for joining us today.
Hello. Welcome.
And I just wanted to ask, what was going on in your life when you were diagnosed?
Lots of things going on in my life. Everything was going okay. I was doing relatively well at work, and I've got two small kids, and everything sort of felt like it was going in the right direction, really. I'd just done my head teacher qualification and was about to have an interview to become a head teacher for primary school, but I didn't get to go to that interview because I ended up in hospital. So there was lots of stuff happening in my life at that moment of diagnosis. Yeah.
And so that sounds really sudden. What brought you into the hospital that day?
Yeah, it was very, very sudden. I'd had about 2 months of back pain, which just got worse and worse, wouldn't go away. And I had lots of, osteopathy and physio and all that. And I tried everything. And in the end, my osteopath, I think it was, and maybe a colleague said to me, why don't you get an MRI scan? And it was a long wait in the NHS. So I just thought, I'm going to pay for an MRI scan. I found a clinic in Waterloo in London, and went there on a Sunday, and they scanned me. And then 3 days later, when I was sitting at work at my laptop doing something, I got the report through, and that was a horrible moment because it sort of, I just received it while I was at work, cold, with no kind of context, and it pretty much just said, your T1 vertebra has collapsed, go to hospital ASAP. And so I went home that night and was all in a bit of a state of shock, really. And I decided I'd go into A&E the next morning because I just thought if I get in there early. So I got up at sort of 4:30 in the morning, didn't really sleep all night, and got a taxi down to King's Hospital, which was only a few minutes away from my house. So I was in A&E by 5 a.m. and I didn't leave hospital for 2 weeks.
That's such, really being ripped out of your life and into this completely different world with no sort of build up to it. And when you saw that result saying that it collapsed, did you know what that meant when it said, okay? So when you got to the hospital, there was that second impact of hearing the diagnosis. And I
didn't get the diagnosis for about 10 days after I'd been in hospital. It took a while. I didn't know what it meant to have a collapsed vertebrae, but the other, helpfully on the report, it listed a series of possible conditions, like osteoporosis. I think they said TB or something like that as well, like could have had an infection in the bone, etc., etc. And myeloma was mentioned, which is what I have. And I looked at the list and I thought, well, I haven't got osteoporosis. I've not had TB. I sort of worked, I've never heard of that one. I've never heard of that one. I think it's myeloma. I sort of just thought, I bet it's that. And I Googled myeloma at that point and I thought, I think, this could be it. And anyway, so I had no idea. And then in hospital, I showed them the picture from the MRI scan. And they, at that point, when they saw the image, suddenly I was in the neuro ward. That's where I was, And so, by the time I got the diagnosis, they'd already sort of ruled out various other things. And I'd spoken to a clinical nurse specialist who'd been sent down to chat to me, who'd mentioned myeloma. And I was thinking, okay, it's all heading this way. And then it was the kind of moment of diagnosis was almost accidental, because I was going for a walk from my bed in my on the hospital ward. I thought I'm going to go for a little walk, and I walked past the space where all the doctors and nurses kind of gather around the computers. And as I sort of walked past it, I just heard, I at the corner of my eye, I saw the consultant who'd been to see me earlier in the week, and I heard him chatting to a nurse, and I heard him saying, "Oh, myeloma at 44, that's a bit harsh, isn't it?" And I just thought, "Oh, I think they're talking about me." And I sort of backed away and I just listened. I listened to them talk about it. And I thought, okay, that's me. That's my diagnosis. That's it. Then they came around the corner and saw me and said, "Oh, we're looking for you." And I said, "Yeah, I know. I know." And we went back to my room, and we spoke about it at that point, and that's what they said. So yeah, they told me my light chains were very high, and that's what it was. So
And
yeah,
what,
that was a shock.
yeah, I was about to ask the question, like, what impact was that on you hearing it in that way? Um,
Well, it was traumatizing. It was, it's horrible. And you just sort of, it's like a slightly out of body experience. You're listening to people talking about you and you're thinking, this doesn't add up. This doesn't make sense. But okay, I take their word for it.
yeah,
Um, and by the point they told me, I've been in hospital for nearly 2 weeks, and had lots of conversations with people. I knew something was coming. So, you know, the shock kind of came in increments, I suppose, over those weeks.
yeah.
Um, yeah, and I'd say that it was the beginning of it was exactly a year ago, actually, pretty much today, that I got that diagnosis. So,
What was your treatment protocol from that point?
well, I finally got out of hospital once they decided my spine was stable, and I had radiotherapy on my spine, which sorted that out. And then I was into 4 months of initial induction therapy, which is immunotherapy and chemotherapy for 4 months every week, and plus pills every day. 4 months of that, and then that sort of ended in July, and I had a couple of months off of nothing, which was great in a way, because I suddenly felt okay again.
Hmm.
Um, just not dragged down by treatment. And then I had a stem cell transplant in November last year, which was hard. um, yeah, hard. Certain phases of it were very hard, and other parts of it were easier than I thought they were going to be. And I came out of the stem cell transplant, and then I had 2 more months of consolidation treatment, which is exactly the same as the 4 months I had at the beginning. 2 more months of it to consolidate the stem cell transplant, and I just finished that last week, in fact. And I had a bone marrow biopsy last Wednesday, and I'm getting the results of that tomorrow. So
So,
it's all happening.
all going on. And how are you feeling in this waiting period now?
I'm feeling the anxiety is building as tomorrow approaches. Um, yeah, I didn't enjoy the 2 months of consolidation treatment because I felt like I'd really been through it all with the stem cell transplant. I thought, okay, I've climbed that mountain. I'm over that. Oh God, I've got to go back into hospital every week now into the chemo day unit, which really was a place of trauma for me. When I first started going in there, the beginning when I was first diagnosed, I really couldn't process that, and I found it extremely difficult. So going back there was hard. Not as hard as originally, but it was hard. And so what I'm feeling now is I'm glad that it's all out of the way, but I just want to get tomorrow out of the way now.
Yeah.
Um, and then whatever happens tomorrow, I'll be going on to a maintenance drug called lenalidomide, which is hard to say. And that's a daily pill. So really it's just about, and that's the promised land, that's what I've been looking forward to really for a whole year, thinking, okay, just get through this, get on the maintenance, carry on with life.
So with that drug that's very hard to pronounce, that is to keep your levels stable, so you wouldn't have to go through more of the treatment that you've just been through.
Yeah. Myeloma is a relapsing, remitting illness, so it comes and goes. And the longer you can remain in remission, the better. Because then you don't have to go through more intense treatments like what I've just been through. So the lenalidomide is designed to keep you in remission for as long as possible. And that length of time varies. Talking about uncertainty and things, the length of time varies. Some people get not much time, like a year or whatever. Other people, I've spoken to people who've been on it for sort of 10 years, still going. So the fact is, we just don't know. And nobody can tell me. And none of the medical people will ever put a number on it. So you just take it. You just take the drug and keep going.
Yeah, and that's huge levels of uncertainty. There's a massive difference between 1 year and a decade.
Yeah.
And so, I can really hear, you've described things as, sort of being kind of a mountain and that time that you had off. I saw the relief even come over your face when you had that little bit of time before the stem cell. How has this been emotionally for you? How has this time impacted you?
It's been difficult for me. I mean, I'm quite an emotional person, I suppose. I feel I feel a lot of things, and I'm not someone who's in any way able to compartmentalize and sort of shut down. Just think I'm just not going to feel that. That doesn't happen for me. I cannot do that. And so it was extremely difficult for me and everybody around me, I would say. Yeah, I was in a huge trauma for a long time, probably most of last year, and I wouldn't say I fell apart because I kept going. A lot of people kept saying to me, "You seem to be doing really well," and I'm thinking, "Yeah, but I know I'm at work, but actually every hour I go into the toilet and I cry for 10 minutes or 5 minutes. I do that every hour at work, and I would go home from work and sort of just disappear to my room and really try and get myself together, and not really interact with the kids, and yeah, I'd say I felt like the kind of bottom had fallen out of my life, really.
Yeah.
And I was very lost, very, very upset, at times very, very distressed, unable to kind of compute it and process it. It's just such a sudden change, so, and also pretty angry as well. And nowhere really to go with those feelings. Not much outlet. Even seeing a counselor at the hospital didn't really, it helps, but it doesn't remove the feeling.
It can feel really isolating.
Oh yeah. You're sort of in your own life, like you always were, but you're also sort of cut out of it and sort of pushed off track. You're sort of almost next to your life.
Yeah, like this.
Yeah, thinking, I remember that. That's not where I am.
This derailing of your life, yeah, and there's a whole different experience. And something about you is still being back at work, sort of in the normality of a day, and yet everything is totally different. One of the images that we sometimes use at Shine is of a iceberg. And, sort of at the top, people are seeing that tiny little bit sticking out. And, they're sort of looking and like, oh, you seem to be doing fine. And yet not really knowing that there's this huge, jagged monster of an iceberg underneath the water. And that image just really came into my mind as you were talking. And that's... It's hard not to be seen for like all of you, So, where did you end up going with those feelings? Where have you sort of sought some understanding or outlet?
Well, a few places. I had a therapist that I used to see years ago, and I hadn't seen him for a few years, but I got back in touch with him. That was quite useful because he knows me. So it was just sort of like, okay, this is Dan's situation, and he knows how I feel about things in life, and that was good. But equally, probably the best things I did were, I've built a network of people around me who have myeloma and who are experienced as patients. I contacted Myeloma UK, and I signed up to their 50s and under support group, because myeloma generally affects people who are older.
Yeah.
So 50s and under support group's useful because we're all people there are sort of late 30s upwards. and they also have a WhatsApp group, and I've met some people on that. When I joined the WhatsApp group, a few people said, if you want to chat, get in touch. And so I did, and I've talked to all of them. And in fact, a few of them live in London, and I've met them, been out for drinks with them, coffee with them. I've got a friend from the Myeloma Support Forum who lives down in Devon, Rich, and I've met up with him, been down to Devon to see him. We speak every week, Rich and I. He was the same age as me when he was diagnosed. He's now 4 or 5 years older than me, I think. And through also social media, I found a lady in the Midlands called Michelle, and I just found her on Instagram. And she's a bit older than me, about 10 years, and she was just on Instagram looking like she was having a nice life, but talking about myeloma. So I sent her a message, and we arranged to speak, and she pretty much saved my life for that year, because she spoke to me, I would say, every day.
Wow.
6 months.
Oh, that's lovely.
Just every day. It was amazing. So yeah, people really. And through social media, I found other people, and a man called Scott, who lives just up the road from me in London. He was on Instagram talking about having myeloma, and I saw that he lived near me, Elephant and Castle, and I thought, oh, that's literally 5 minutes from where I live. So I just sent him a message, and we've met up a few times. Him and his husband have been around for lunch, So really what I've done is I've connected. I've got some friends in America that I've connected with, who I also found one on Facebook and one on Instagram. Just positive stories of people living with it, really.
Yeah, I can really, and even hearing you talk about that, like what a lift when you talked about Michelle calling you, and I mean, you said she saved your life, like that being able to talk to someone who understands, maybe they're in a slightly different place, but who gets what you're going through is massive. I'd love to bring Lucy into the conversation here. Lucy, how has it been hearing David talk?
Yeah, lots of sort of moments that I can relate to as well. That sort of feeling as if someone's scribbled all over your life script and not really sure what the future holds initially. My diagnosis came out of the blue as well. I'd forgotten my lunch one day and popped home to grab it, and it was at that moment the GP called to say, you need to come in and see me today. So I know what that feels like.
Yeah, so you had just gone for a regular GP visit?
She called me in because I'd had a blood test.
Okay.
Just had a routine blood test, and it was picked up there. Yeah.
And how were you feeling at that point?
I didn't really take it in at that moment. I was in a rush. I had to go back to work. I remember speaking to a colleague by the filing cabinets and saying, I've got to leave work a bit early today because I need to go and see the GP. She reckons I've got leukemia. Well, that can't be true.
Oh, wow. I mean, if there's ever a reason to get out of work, right? Like that should be it, I was at work when I found out as well. I asked to leave. And when they said why, I was like, I got cancer. And yeah, like I was like, oh, that's like today was probably the best day ever for using that as a reason to get out of work. So, but you were there kind of thinking it can't be right, that, maybe they've made a mistake or.
Yeah. Didn't make sense. Made no sense whatsoever. I was 38. I'm an occupational therapist. I was working in the NHS. And we were in the process of remortgaging our house. I was also thinking about reducing my hours and going into private practice, and all that went by the wayside.
What was your first interaction with the doctors? Like, what did they tell you about your condition?
When I saw my GP, she was very sort of nonchalant about it, really, and just said, oh, it's one of those things, it's very slow growing, you'd be very lucky if you need treatment in the next 10 years, you might never need treatment at all, we're just going to monitor you, there's nothing to worry about, you need to just get on with things, but we'll refer you to the hospital and you'll be seen in a couple of weeks. So my head was spinning.
And how did you take that information? I mean, I can imagine that she maybe thought she was being reassuring. What was the impact on you of hearing it put like that?
Well, I was still she'd been poking and prodding me, so I was still getting dressed behind the curtain as she said that. And I remembered to say, "Oh, okay, that's fine," and toddled off home. And I remember I got home, the washing machine was bleeping, so I was unloading that, and my husband said, "Oh, how'd you get on?" I said, "Oh, they reckon I've got leukemia," and it didn't sink in. Didn't sink in.
So, did she sort of, do you think in that moment that she almost gave you a template to kind of downplay it?
I think what it was because I was so young, like David, my chronic lymphocytic leukemia, the average age of diagnosis is 70. So I didn't fit the mold. And I think everybody just thought I was a bit of an anomaly. And I was reasonably healthy at the time. I had one swollen lymph node in my groin, and apart from slightly elevated bloods, there was nothing else going on. So I think everybody just thought this was going to be a real slow burn. And also, I don't think she'd ever come across it before either. So I don't think she was that well versed in it,
Yeah.
which is often the case.
I mean, just as an off the cuff comment as you're on the other side of the curtain getting changed. And then almost I see that being mirrored when your husband asked you later, how did it go? Almost coming out like almost in a very similar kind of way. Was there a moment when the impact hit you? Or do you feel like there was a long time that you were sort of swatting it away and kind of, you know, maybe doing a similar kind of thing with it, minimizing it a bit?
I think the impact came when I Googled it, because of course I looked at all the out of date research that was on there, and I thought I was going to be dead in 5 years, which wasn't true at all, but it was out of date research. So that hit me.
Yeah.
Um,
And did you tell people in your life?
no, not really. I only told people very close to me. I've got a vulnerable family member who wouldn't have understood, and it would have distressed her greatly on a daily basis, to know that. And I was finding it difficult to get my head round the fact that I've been diagnosed with cancer, but they weren't going to do anything about it.
Right.
I was going on watch and wait. So if I couldn't get my head around it, how was anyone else going to understand?
Yeah.
And I think people are conditioned really to equate cancer with treatment and looking ill, and I didn't, and I felt a fraud. I was saying I've got cancer, but they're not doing anything about it, and I'm okay, and it didn't make sense.
Because everything that, you know, we're told is like early diagnosis and get checked out. All the posters, all the things are like, you know, if it's caught early. And yeah, it's hard to get your head around. You have a diagnosis, they know it's there, but they're not going to do anything. So was it a process then of waiting till you're sick before then getting treatment?
Yeah, pretty much. Yeah. All the while I could manage the symptoms, and it, you know, I could get on with life, and they weren't getting in the way. And although my numbers were steadily climbing, they weren't too worried. They were more about the symptoms and the impact on my life.
So what were some of the symptoms?
Fatigue was massive. I had swollen lymph nodes externally and internally. Lots of bruising, anemia. That was pretty much. Oh, and I had an enlarged spleen as well. So that was very uncomfortable, and that affected my appetite. So I lost a lot of weight as well.
And so you're looking at these changes in your body, knowing what's causing them, and yet knowing that you're going to have to wait even longer to get treatment. To how long was that whole process, like, that you were
For
living with
me,
that?
2 years before I needed treatment. I mean, some people go 10 years before needing it. Some never need it at all. It goes that slowly. But yeah, I was 2 years.
And did you access any cancer support during that time?
I stumbled across an online forum via Health Unlocked, run by the CLL Association. And that was my main source of education, really, and support. It's a secure group. The CLL Association, a UK-based charity, but it's a worldwide forum. So hearing about research that was going on in America and Australia before it arrived in the UK, was really helpful.
So did you felt like you were sort of getting really educated on your condition through that, or was it more kind of an emotional connection?
It was education more than anything. I really felt that knowledge was power, get to know your enemy and all that.
Yeah. Yeah. And then after 2 years you had treatment. And how long was that treatment?
The treatment lasted for 6 months. I had combination of immunotherapy and chemotherapy.
And are you on any kind of maintenance like David, or how does the kind of the rhythm of that continue forward, or is it just a completely blank slate in terms of whether it will relapse or?
Yeah, it's a blank slate. It's finished. Just waiting for it to come back, I suppose.
Which is, it's very, I think there is like such a, you had mentioned to me in the previous conversation about cancer boxes, and there is this, box of going through treatment and then recovery, end of treatment. And people seem to understand that. They're like in it, people seem to rally around, and then they're like, okay, when's the end of treatment? And sometimes when treatment is ongoing, it's, what you were saying about like it not being really understood, or watching and waiting, people are quite confused about. And, but at the same time, it's not necessarily quite the same as incurable, because there's a management that's happening. So, so what has it been like now to kind of talk a bit more about what's been going on with you and accessing, or I know that you came along to one of the Shine chronic support chronic cancer groups. How has that been?
That's been good. I'm not used to talking about it. I'm not used to being with people who have cancer either. I haven't, unlike David, I haven't looked for that. I suppose I've just tried to get my head down and get on with things, really. I think I appear outwardly normal and life just carries on, but no one really sees the emotional stress that goes along with it, really. I mean, leading up to treatment, I was very anemic, so I would get out of breath climbing stairs, and I would have to recover before I rang my patient's doorbell, that kind of thing. I coached people in fatigue management, but I never took any notice of the advice that I was giving. I didn't think it applied to me. I think I've got used to painting on a smile, and I did it before treatment, and I just carried on, really. I definitely compartmentalised my life into work and home. I've got a new job now, in a completely different service, and only my boss knows. And I just wanted to be me, and I saw it as an opportunity to be me without any label. And it's good. It gives me a bit of respite, really. because I just focus on work when I'm there, and if the days I come in and I'm fatigued and I look rubbish, no one's going to comment and relate it to, oh, it's your leukemia. It's just they don't know any of that. But it can be lonely at times, and there's definitely a part of me that I'm obviously holding back, and I have to sometimes really watch what I say. COVID nearly outed me as well, when I was having to shield. Um, so, yeah.
Yeah, well, I'm so glad that you're here with us today, sharing and talking, and that you found some other people in the Shine group that you can also talk to, because it is, I can totally hear that thing of there's a certain freedom of being at work and sort of being able to compartmentalize and not have it necessarily brought up in the middle of the day, but at the same time, I can really hear that. What you were saying, that it can be lonely as well. And watching what you say, and even having to second guess yourself, and having people that you can just be completely yourself. They can see the whole iceberg above and below, can be, so unifying. And I'd love to bring Kerrie in. And Kerrie, I've seen you nodding at several points while David and Lucy have been talking. So how has it been for you hearing from them?
Yes, I always find it really insightful listening to other people's experiences, and so much of it resonates. So certainly what they were both saying about being sort of ripped out of your professional life, particularly when things are going well. And also the importance of accessing the right support for you. And it's a balance between sort of reaching out, connecting, but also not broadcasting it. And I think it's different for each person. I think that's very true. And so my life was, professionally, my life was going very well. So shortly before my cancer was discovered, I just sketched out a 5-year plan for my future. I planned to study for a PhD part-time and teach part-time. I was an English teacher teaching English as a foreign language in university. I had 3 job offers, which was great. The work was mostly contractual. I also had an invitation to apply for a 4th job. So I was headhunted.
Nice.
And I had found a supervisor for my thesis. And so I'd chosen something I wanted to explore, and I'd found the person with the expertise to supervise it. Personally, my life was, I had a great group of friends, but I was recently single, and I was 39, and I was wanting to start a family. And when you're in that position, you can't help but notice everywhere you look, you see pregnant women and happy families. And it's just like they're suddenly really, really visible. But I was still hopeful of meeting a partner and having children. It was possible. But cancer just took that away.
How did you find out?
I went for a routine smear, and for reasons to do with my health insurance. It happened to be with the gynecologist. And it was my first appointment with her, and she was incredibly thorough. She checked my breasts. She gave me a pelvic exam. She took the sample for the cervical cancer screening, and she also gave me an internal ultrasound. And she found a large cyst on one of my ovaries. And everything happened really fast. She was very, very, very good. She ordered blood tests and scans. And then when my tumor markers were elevated, she advanced the scans. She phoned the hospital to advance them, saying this is urgent. So I went from needing to lose one ovary, and thinking it hadn't spread, to having a 6-hour operation where I was diagnosed with advanced ovarian cancer. And they removed all my reproductive organs, part of my bowel, appendix. It was a really very extensive operation. And then scans revealed some small nodules in my lungs, which placed me in the stage 4 category, requiring months of chemo targeted therapy. And what it's just the brutality of it. It's a cancer, it's extremely rare under 40. It's kind of rare, not ultra rare. I've met many different people with different types of cancer, but there's no screening test for it. And the cervical cancer screening is for cervical cancer, it's not for any others. And where I was in that position of wanting to have children, and then this walking into the hospital with my fertility, and then this just sudden removal. It was, yeah, brutal is the best word to describe it. I woke up and I was in instant surgical menopause, and just really not knowing how long I was going to live. That was 5 years ago. It was May 2018. And the whole relentlessness of it is just, it's really exhausting. It's been the hardest 5 years of my life. And I've been on this treatment treadmill. In total, I've had 15 months of chemo. I've had 6 to 7 different types of therapy. I'm currently on my 3rd line treatment. I have my tumor markers tested every 3 weeks. I have a CT scan every 12 weeks. And after recurrence or progression, or even just a regular scan, sometimes all I can do is just to come home, crawl into bed and cuddle my teddy. And that's the only thing that just makes me feel okay.
Yeah.
And in terms of the physical effects, I can't always rely on my body from day to day. With my current treatment, I have a week where I really can't do much at all. Then I have a moderate week, and then I have like a reasonable week. But it's really the cumulative effect. And the thing about chronic cancer is, like, how can your body recover if you're always on treatment? You've just got this residual level of fatigue and side effects. And I use a weekly planner to manage my energy. That's the best, seems to work best for me. I need to think about the whole week. And what I've kind of developed is like an inkling about the balance of activities, about what I can do and what needs to be done, what's essential. But there's still a huge amount of uncertainty. And for me, it's like these hurdles, like how, will this treatment work? How long will it work for? But I try and remind myself that sometimes within uncertainty, there can be the possibility of a future treatment. So in 2021, I had the crushing certainty that my 2nd line treatment had failed. But I was eligible for a trial, and I happened to be randomized to an experimental treatment, which I'm still on. And it's turned out to be more effective and less toxic, although it does have side effects. So there are lots of difficult things that I face. Particularly, I find it hard when I encounter women with the same disease and the stage who stayed in remission after their 1st line treatment. And it happens to be every so often. And when it happened a year ago, I wrote in my journal, I just wrote, if only I could experience that nervous waiting for scan results once a year. I could be living a different life. I could be making plans to adopt. And then my mind starts up this regret, there's anger, there's frustration. That's not going to be me, that I'm always going to be on treatment. And it's so unfair, it's beyond my control. because I did, after my first line treatment, I went into remission. Many women do with advanced ovarian cancer, but the recurrence rate is quite high. And so that's quite hard that that option of a cure is gone. And I really have to pull myself back mentally. And I think after this happened, I went and sat in the park and I just had to remind myself, okay, that's gone, but I'm on a trial, and maybe with this new treatment, I'll be part of a group whose experimental treatment transforms the odds for women in my situation.
There's so much in what you've expressed, and thank you so much for sharing that, because the relentlessness, and one of the things that we often hear is that sometimes the hardest time for people is the end of treatment, because that's the time when they're like processing everything that's happened. But almost, how do you have the energy to process when things are continual? Like you were saying, the waiting for results, is so a part of your life, that to try and sort of weave some time in there for you to support you as you're going through that. And I loved what you said, that in uncertainty you've been able to find these like little bits of possibility, that it sounds like they sustain you. And speaking of kind of sustaining, David, how has it been hearing from Lucy and Kerrie? I know all of your experiences are so different. Were there parts that you related to?
Yeah, loads that I related to, definitely. Especially the whole thing about uncertainty, and like Lucy said, I think about, it's like someone's scribbled all over the script of your life, and that's sort of what I felt. And the same with what Kerrie said. I think about, you're making plans for whatever, to have kids or whatever your plans are, and that is the script of your life and the story you're sort of writing and telling yourself, and then suddenly something's come into it which kind of completely destroys that script that you've got.
Yeah.
And that story, and you then have to sort of try and rebuild something new and rebuild a new narrative somehow. So I relate to all that, and the uncertainty that we're all in different ways, about how long treatment will last, how long it will be before you need more treatment. Suddenly you feel like, I personally feel like it's hard to plan the future, because you can't predict anymore how long it's going to be, or what you're going to have to deal with, what hurdles you're going to have to jump over. So yeah, just that feeling of loss of what was.
Yeah.
And now where you're at is a new situation that you have to deal with.
It's really layers of grief, isn't it? Like the loss of the life that you were having and that you expected to have. And I know that when me and Kerrie spoke before, like that loss of the opportunity to have a child, and the loss of the child that you thought you were going to have, those griefs are not necessarily always perceived by people around us. They're not necessarily seeing that. And so having a space where you can acknowledge, like, actually, this is a big thing, that this derailing, and no one puts this in their life plan. It is, and the anger that I think, several of you have expressed at different points. If there's someone listening to this that also has a chronic cancer, and is there something that you wish that you had done sooner in terms of finding support, or something that just really helped you that you would want to share with someone else? Like if you could go back to yourself a couple of years ago or a year ago and sort of whisper a bit of advice, is there anything that you would want to share? And let's start with David, and then we'll go around to Lucy and then Kerrie.
There's nothing that I could say to myself, that I should do differently, because I didn't feel I was in a position to do things any differently at that point. I was just surviving. But, the thing which helped me is other people. Connecting to other people who have it, and also my family and friends. But really building a network of people in the same or a similar situation who could tell me a new story like this, like I was just saying. Some people who could helped me rebuild a sense of my future and what it might be like. And that's what got me through 100%. That's what helped.
Thank you, David. And Lucy, do you have something that...
I consider myself quite fortunate that I had time to learn about my CLL and to learn about the symptoms and the treatments that were available to me compared to someone who had an acute cancer, or like David, it came on very suddenly. I felt empowered by the knowledge I was able to gain from the forums that I went on, definitely. And that definitely helped me feel more in partnership with my consultant when the time came for treatment.
Lovely. Thank you, Lucy. And Kerrie, is there something you'd like to share?
Yes. Yeah, I'd say that whatever you're feeling is completely understandable and legitimate given what's happened to you. However, can be this chasm between your life and the lives of people around you, and even the ones who love you the most. And the most helpful thing I've found is just carving out space for myself, for people who get it, and that connection. And it could be through reading memoirs, a blog, online support groups, listening to podcasts, and you've just got that connection, that acknowledgement, people who get it.
Yeah, and I know that you were telling me about a quote that you read. I can't remember the name of the person's book, but do you have it?
This is a quote from Kate Bowler, and she wrote a wonderful memoir called Everything Happens for a Reason and Other Lies I've Loved. And when talking about people with chronic illness, she says, we're not problems to be solved. We're just people to be loved.
Oh, thank you. And I know that the quote really resonated with you. Thank you to all of you for your time, and it's just been an absolute pleasure to meet you all. And thank you, as always, to Radio Facilities for sponsoring our podcast. And if you have a chronic cancer, we do have a group that meets up. I think it's like once a quarter. Contact us at shinecancersupport.org and find out more. Till next time, bye.
Not Your Grandma's Cancer Show.